Ruitenwag is a predominantly elderly community, and the elderly were scared.
COVID came in and thinking you had to go to the clinics. What if you get affected with this COVID?
A lot of people couldn't go to facilities to collect their medication. There was a need to make sure that people with chronic conditions were able to access their medication, since there's a high risk that there are negative health outcomes for people who aren't able to access their medication during lockdown. And there's also a need to protect healthcare workers from overcrowded facilities. Percept is a multidisciplinary consulting firm that works in the health and financial services space. Our aim is to make the world a more healthy and financially resilient place. I think the availability of quality data is always a problem when it comes to healthcare in South Africa, and I think whatever we can do to improve the data collection processes and automate those processes and digitize those processes is really important for us to be able to track the burden of disease in South Africa in a centralized way. So the Gates Foundation, who fund some of our projects, had approached Uber to support the home delivery of medication in the Western Cape, in KwaZulu-Natal and in Gauteng as well.
They paid for that delivery service of the Uber drivers that would transport our packages. So the clinic has played like a pivotal role. It is a starting point of the home care delivery system. We had to involve our clinicians, our nurses and doctors. We also had to involve our patients to inform them that we're going to be going forward with a new process. And we had to partner up with the NGOs to assist in the distribution of the home care delivery system.
The way that medication is delivered is that it comes from a Central Dispensing Unit in the Western Cape called the CDU. They package the medication and the CDU delivers this medication to facilities.
We as a facility, we see chronic patients on a daily basis. Prior to COVID, the patients had to come to the facility to come collect their script at the facility. When COVID struck, we spoke to our NGO Tehillah. We have a very good relationship with them. They usually did our home-based care, so the department arranged that their carers literally take the packages to the homes of the patients.
Die home-based care projek was een van die eerste projekte wat begin het, want dit was in 'n tyd waar die gemeenskap nie na die daghospitaal toe kon gaan nie.
Aan die begin was dit nogal vir my baie goed geweest en dit het my baie gemaklik laat voel dat hulle dit so gestel het om dit vir my na die huis toe te bring. En dit het my baie goed gedoen.
The way they approach you, especially as a senior, it makes you glad because you don't always get people that come around, so they always have friendly faces.
Ek voel baie goed. Regtig waar, en dit het 'n groot verskil kom maak. Vir al die tye wat ek miskien moes gegaan het en lank gewag het, het hulle regtig my probleem kom verlig.
En hulle is dankbaar. Hulle is dankbaar daarvoor, want hulle hoef nie die werk te bly nie om medikasie te gaan haal nie.
Being able to show that home delivery has had an impact on actual measurable clinical outcomes for patients was a big win. And also being able to translate some of our research into increased funding for the Department of Health for the home delivery of medication was also a big win. I mean, ultimately, we want to make the world a healthier place, and I think we were able to do that as part of our work in this project.